Hi, I'm Allison Blackwell, a physical therapist at Island Hospital, and I'm here to show you a few exercises for osteoporosis. According to the Centers for Disease Control and Prevention, osteoporosis affects about 25%, or 1 in 4, of women aged 65 and over, and about 5%, or 1 in 20, of men aged 65 and over. Many people with osteoporosis do not know that they have it until they break a bone. Often these breaks come from falls. Exercise has been known to help strengthen the body and reduce our chance of falling. To do these exercises with me, you'll need to wear a pair of supportive shoes and have access to a sturdy chair and resistance bands that you can get in any sports store, big box store, or online. If any of the following exercises cause joint pain, please stop and discuss exercise with your doctor or physical therapist. It is normal when starting an exercise program to feel your muscles, but you don't want to do an exercise that causes any sharp pain. In general, if you have already been participating in an exercise regime and you get an osteoporosis diagnosis, it's generally safe to continue on with what you've already been doing. You may want to change some of your exercises to avoid sit-ups or lifting with a flexed spine, think lifting a heavy Thanksgiving turkey out of an oven, because those movements increase your risk of a compression fracture. You would also want to be careful with forceful spinal rotation, like twisting in tennis or golf. The following exercises are great for people with osteoporosis, whether you have been previously exercising or not. Weight-bearing exercises can help you maintain your bone density in your legs and spine, and lifting weights can help maintain your bone density in your arms and legs. We'll also be doing 2 stretches that work to stretch out muscles in the front of your body. With osteoporosis, we want to stretch out the muscles in the front of our body and strengthen the muscles in the back of our body. This is to fight against the postural changes that often happen with advancing osteoporosis. The first exercise we'll be doing is moving from sit to stand. Sit on the edge of a sturdy chair and stand up. You'll want to keep your knees over your toes, not letting your knees collapse in. Keep your hips back so that your knees don't go in front of your toes. Try to do this exercise without using your arms, but if you need to make it easier, you can push up with your arms or stand up from a higher chair. In the beginning, I would suggest starting with a small number of reps and seeing how you feel the next day. In general, starting with 10 repetitions should be safe, and then adding a few until you're doing 2 to 3 sets of 15 repetitions. To make an exercise more challenging, you can add resistance, in this case standing up from a shorter chair, or you can add repetitions, or you can increase the frequency of how often you're doing the exercise, but you don't want to increase all 3 of these things at once. Next, we'll be pulling on this band with both of our arms in a diagonal direction. It's important to keep good posture while doing this exercise, so if you need to stand next to a wall to make sure that you're not bending forward, feel free to do so. You're going to pull your arms out, leading with your thumbs. The tighter you grip the band, the harder it will be. Think about squeezing your shoulder blades together as you do this exercise. You want to feel the muscles in your upper back and arms. Then switch arms so that the arm that was pulling up is now pulling down. We'll do this a few times so that you can practice your form. The next exercise is a shoulder stretch. Stand facing a corner or in a doorway and place your arms at a 90-degree angle and gently lean forward. If that's too hard, you can keep your elbows closer to your body. For this exercise, you should hold it for at least 30 seconds. Start out gentle, and then as you hold the stretch, gently lean in a little more. The next exercise is a stretch for the front of our hips. If this stretch is challenging for your balance, please hold on to something sturdy. Stand with your front knee bent. The back heel can be up if you only feel this stretch in your calf. You should feel a stretch in the front of your hip. You should hold this stretch for about 30 seconds and then switch legs to stretch the other leg. The last exercise we'll be doing today is a balance exercise. For some of you, an appropriate exercise might be standing with your feet together. However, for others, that might be too easy. You want to balance exercise to be challenging but doable, and not so hard that you're falling all over the place. Stand next to something sturdy like the kitchen sink so that you can touch down if you need to. If standing with your feet together is too easy, then you could try standing with one foot in front of the other like this, or even try standing on one leg. If standing on one leg is still quite easy, you could try to do it with your eyes closed. But be very careful and make sure that you can touch down on something sturdy if you need to. Try to hold your balance for 1 minute with whatever foot position is most appropriate for you. For more information on how to schedule an appointment with Island Hospital Physical, Occupational, and Speech Therapy, please call 360-299-1328 or talk to your medical provider to determine the next steps.